Uncircumcised males, often referred to as intact males, have a natural anatomical structure that has been the subject of various medical discussions and debates. The foreskin, or prepuce, is a retractable fold of skin that covers the glans of the penis. This structure serves several important purposes, both biological and sexual. Understanding the medical perspective on being uncircumcised requires a thorough examination of anatomical, physiological, and clinical considerations. From an anatomical standpoint, the foreskin is composed of a double layer of skin, which contains a rich supply of nerve endings. This makes it a sensitive part of the penis, contributing significantly to sexual pleasure. The foreskin also plays a role in protecting the glans, which is typically a sensitive area. When the foreskin is intact, it can help maintain the moisture of the glans, preventing it from becoming dry and irritated. This protective function is particularly important during the early years of life when the glans may be more sensitive and vulnerable. From a physiological perspective, the foreskin is involved in several important functions. One of its primary roles is to facilitate sexual arousal and pleasure. The nerve endings in the foreskin are densely packed, enhancing tactile sensation during sexual activity. Many studies suggest that men who are uncircumcised report heightened sensitivity and pleasurable experiences during intercourse due to the presence of the foreskin. This can lead to a more satisfying sexual experience, both for the individual and their partner. Medical discussions surrounding circumcision often focus on potential health benefits versus risks. Proponents of circumcision argue that it can reduce the risk of certain infections and diseases, including urinary tract infections, sexually transmitted infections, and penile cancer. However, it is important to note that the rates of these conditions in uncircumcised males are generally low. For instance, urinary tract infections are more common in infants, but the overall incidence remains low in both circumcised and uncircumcised individuals. Similarly, the risk of penile cancer is low, and most cases occur in older men, often related to other risk factors rather than the presence of the foreskin. The medical community also recognizes that proper hygiene is crucial for maintaining the health of uncircumcised males. Regular washing of the penis, including the foreskin, is essential to prevent the buildup of smegma, a substance made up of dead skin cells and oils. When not cleaned properly, smegma can lead to irritation and, in rare cases, infections. Education on hygiene practices is vital for uncircumcised males, especially during childhood and adolescence, to promote a healthy lifestyle. Another aspect of the medical perspective on being uncircumcised is the consideration of cultural and religious practices. Circumcision is often performed for religious or cultural reasons, and this can influence perceptions of intactness. In many cultures, circumcision is seen as a rite of passage or a necessary procedure for religious adherence. This cultural significance can lead to varied attitudes towards uncircumcised males, with some viewing it as abnormal or undesirable. It is important for medical practitioners to approach this topic with sensitivity and understanding, recognizing the cultural context in which individuals exist. In addition to cultural influences, the medical community acknowledges the importance of informed consent when it comes to circumcision. For infants and children, the decision for circumcision is typically made by parents or guardians. Informed consent must be based on an understanding of the potential risks and benefits associated with the procedure. Parents should be made aware of the possibility of remaining uncircumcised and the associated health considerations. For older individuals, the decision to undergo circumcision should be made with a clear understanding of their options, personal beliefs, and medical needs. There is also a growing body of research examining the psychological and emotional aspects of being uncircumcised. Some studies suggest that men who are uncircumcised may experience feelings of shame or embarrassment due to societal pressures and stigmas surrounding circumcision. This can impact self-esteem and body image, leading to anxiety in intimate situations. Open discussions about these feelings and experiences are essential for promoting mental health and well-being among uncircumcised males. Mental health professionals and medical practitioners should be aware of these dynamics and provide support for individuals struggling with their identity related to circumcision status. In recent years, there has been an increasing push for medical professionals to engage in a more balanced and evidence-based discussion about circumcision. Advocacy groups for both circumcision and intactness have emerged, each presenting their arguments to promote their stance. This has led to a more nuanced understanding of the topic, encouraging healthcare providers to respect individual choices while providing comprehensive information. The medical perspective on being uncircumcised also intersects with public health considerations. Some studies have suggested that circumcision may reduce the risk of HIV transmission, particularly in areas with high prevalence rates. However, it is important to note that circumcision does not provide complete protection against sexually transmitted infections. Safe sex practices, including the use of condoms, remain essential for reducing risk. Public health campaigns must emphasize education about both circumcision and safe sex practices to ensure individuals can make informed decisions. Furthermore, the concept of bodily autonomy plays a critical role in discussions about circumcision and intactness. Many argue that individuals should have the right to make decisions about their own bodies, including whether to undergo circumcision. For infants, this raises ethical questions about consent and autonomy. Advocates for bodily autonomy emphasize the importance of allowing individuals to make choices about their bodies when they are old enough to do so. This perspective encourages respect for personal beliefs and values while promoting informed decision-making. In conclusion, the medical perspective on being uncircumcised encompasses a wide range of considerations, including anatomical, physiological, cultural, psychological, and ethical factors. Understanding the role of the foreskin, the importance of hygiene, and the implications of circumcision is essential for promoting health and well-being among uncircumcised males. It is crucial for medical practitioners to engage in open and respectful dialogue about circumcision, providing individuals with the information they need to make informed choices about their bodies. By fostering a comprehensive understanding of this topic, we can promote a more inclusive and supportive environment for all individuals, regardless of their circumcision status. Ultimately, the decision to remain uncircumcised or undergo circumcision should be based on personal beliefs, informed consent, and respect for individual autonomy. Uncircumcision, particularly from a religious perspective, encompasses a wide range of beliefs, practices, and cultural considerations that vary significantly across different faiths and communities. The topic invites a profound exploration of the theological underpinnings, the historical contexts, and the personal experiences surrounding the practice and its absence. Understanding circumcision, or its lack thereof, requires a nuanced approach that respects the diverse beliefs held by individuals and communities worldwide. In the context of Judaism, circumcision is a deeply embedded ritual known as Brit Milah, which signifies the covenant between God and the Jewish people. This practice dates back to the time of Abraham, who, according to the Hebrew Bible, was commanded by God to circumcise himself and his descendants as a sign of the unique relationship with the divine. For Jewish families, this act is not merely a physical alteration but a profound spiritual commitment that binds them to their faith and heritage. The Brit Milah is typically performed on the 8th day of a boy's life, marking an important moment in the child's spiritual journey. This rite of passage is celebrated with a ceremony that includes family, friends, and often a celebratory meal, emphasizing the community aspect of faith. Conversely, within many Christian traditions, the significance of circumcision is viewed differently. The New Testament presents a critical shift in the understanding of circumcision, particularly as it relates to the inclusion of Gentiles in the early Christian church. The Acts of the Apostles recounts a pivotal moment during the Council of Jerusalem, where early church leaders debated whether Gentile converts should be required to adhere to Jewish law, including circumcision. The decision was made that faith in Jesus Christ, rather than adherence to the law, would be the primary criterion for inclusion in the Christian community. This theological shift led many Christians to view circumcision as non-essential, and thus, for many, being uncircumcised carries no religious stigma. Instead, the focus is on the internal transformation of the heart rather than external physical characteristics. In Islam, circumcision, known as khitan, is seen as a sunnah, meaning it is a practice that aligns with the traditions of the Prophet Muhammad. While it is not explicitly mandated in the Quran, circumcision is widely practiced among Muslim communities and is often viewed as a rite of passage for young boys. The practice is associated with cleanliness and physical purity, which are significant values in Islam. However, there is variation in practice and interpretation among different Islamic sects and cultures. Some Muslim communities may practice circumcision shortly after birth, while others may wait until the child is older. In this context, being uncircumcised can raise questions about adherence to cultural and religious practices, but the implications can differ widely based on individual beliefs and community norms. Beyond these three major religions, various indigenous and tribal cultures also incorporate circumcision or, conversely, choose to forego the practice. For some, circumcision is intertwined with specific cultural identities and rites of passage into adulthood. In certain African cultures, for example, circumcision is not only a religious act but also a critical component of initiation into adulthood, signaling readiness for community responsibilities and expectations. In contrast, some groups reject circumcision based on historical trauma, the impact of colonialism, or a desire to preserve traditional practices that do not include this procedure. The decision to circumcise or remain uncircumcised can thus reflect a complex interplay of identity, culture, and personal belief systems. The discussion surrounding circumcision also intersects with contemporary debates about bodily autonomy, consent, and human rights. In recent years, advocacy groups have emerged that challenge the practice of infant circumcision on ethical grounds, arguing that it is a violation of a child's right to make decisions about their own body. These activists emphasize the importance of informed consent, pointing out that infants are unable to provide such consent. This perspective has gained traction in various parts of the world, leading to increased scrutiny of the practice within religious and cultural contexts. Those who advocate for the cessation of non-consensual circumcision often emphasize the need for open dialogue within communities about the implications of the practice and the value of respecting individual autonomy. Despite the ongoing debates surrounding circumcision, it is essential to approach the topic with sensitivity and respect for the beliefs and practices of others. The decision to circumcise or remain uncircumcised is often deeply personal and influenced by a variety of factors, including religious beliefs, cultural traditions, family practices, and individual values. In many cases, families may feel it is their duty to uphold the cultural or religious practices, fostering a sense of belonging and continuity within their communities. Circumcision can thus serve as a powerful symbol of identity, connecting individuals to their heritage and shared beliefs. Moreover, The discourse surrounding circumcision is often fraught with emotional weight, as it touches on themes of faith, identity, and belonging. For those who are uncircumcised within traditionally circumcising communities, feelings of alienation or difference may arise. This experience can be compounded by societal expectations and norms that place value on conformity. Conversely, individuals who come from non-circumcising backgrounds may grapple with their own feelings of curiosity or misunderstanding when encountering circumcision practices in other faiths or cultures. Navigating these complex emotions requires empathy and a willingness to engage in thoughtful conversations that honor diverse perspectives. As society continues to evolve, the conversation surrounding circumcision remains dynamic and multifaceted. With the advent of modern medical practices and a growing emphasis on individual rights, many communities are reevaluating traditional practices in light of contemporary values. This shift invites an ongoing dialogue about the meaning and significance of circumcision, how it aligns with modern understandings of health, ethics, and individual agency, and how communities can honor their traditions while being responsive to changing societal norms. Ultimately, the topic of being uncircumcised from a religious perspective serves as a lens through which we can explore broader themes of identity, belief, and community. It challenges us to consider how our values shape our practices and how those practices resonate within our personal lives and the lives of those around us. By fostering open and respectful conversations about circumcision and its implications, we can create spaces for understanding and compassion, allowing individuals to navigate their beliefs and choices authentically. In conclusion, discussing circumcision and its absence encompasses a rich tapestry of religious beliefs, cultural practices, and personal experiences. Whether viewed through the lens of Judaism, Christianity, Islam, or other cultural contexts, the practice of circumcision is deeply intertwined with questions of identity, faith, and belonging. As we engage with this topic, it is crucial to approach it with sensitivity, empathy, and a commitment to understanding the diverse perspectives that shape our world. Ultimately, the journey toward understanding circumcision and being uncircumcised invites us to reflect on the values that guide our lives and the connections that bind us to one another across the boundaries of belief and culture. When discussing the topic of uncircumcised penises and potential problems during intercourse, it's essential to approach the subject with sensitivity and an open mind. The conversation around circumcision often evokes strong feelings, cultural beliefs, and personal experiences. While some individuals may not experience issues, others might encounter challenges related to being uncircumcised. Understanding the anatomy and function of the uncircumcised penis is crucial. The foreskin, which covers the glans or head of the penis, is a natural part of male anatomy. It serves several purposes, including providing protection to the sensitive glands and maintaining moisture. During sexual arousal, the foreskin retracts, exposing the glands, which can enhance sexual pleasure for some individuals. However, there can be concerns associated with having an uncircumcised penis. One common issue is difficulty in retracting the foreskin, known as phimosis. This condition can lead to discomfort during sexual activity and may require medical intervention. If the foreskin cannot be easily retracted, it can cause pain or even tearing during intercourse. It's important for individuals experiencing this condition to consult with a healthcare professional for guidance and potential treatment options. Another concern is the risk of infections, such as balanitis, which is inflammation of the glands caused by poor hygiene or irritation. This condition can lead to discomfort, soreness, and difficulty during sexual activities. To mitigate this risk, maintaining proper hygiene is vital. Regular cleaning of the genital area, including the foreskin, can help prevent the buildup of smegma, a substance that can lead to infections. Some studies suggest that uncircumcised men may experience a higher incidence of urinary tract infections, UTIs, compared to their circumcised counterparts. While the difference may be marginal, it's essential to be aware of the signs of a UTI, which can include burning sensations during urination and frequent urges to urinate. If an individual suspects they have a UTI, seeking medical advice is necessary to address the infection promptly. There is also evidence to suggest that sexual partners of uncircumcised men may experience discomfort during intercourse due to the presence of the foreskin. This can occur if the foreskin is not adequately retracted, leading to friction. Open communication between partners is essential in these situations. Discussing preferences and any discomfort can lead to finding solutions that enhance the sexual experience for both parties. In some cases, partners may be concerned about the appearance or odor associated with an uncircumcised penis. These concerns can stem from misunderstandings or lack of knowledge about proper hygiene practices. Education plays a crucial role in dispelling myths and fostering a healthier dialogue around sexual health. Moreover, emotional factors can come into play when discussing uncircumcised penises and sexual experiences. Societal norms and cultural influences often shape perceptions of masculinity and sexual desirability. Uncircumcised men may feel self-conscious or anxious about their bodies, particularly in intimate situations. Building self-acceptance and fostering open conversations about body image can help alleviate some of these concerns. While there may be challenges associated with having an uncircumcised penis, many men and their partners enjoy fulfilling sexual relationships. The key lies in understanding one another's bodies, communicating openly, and addressing any issues that may arise. Sexual compatibility is not solely determined by circumcision status, rather, it encompasses a range of factors, including emotional connection, trust, and mutual respect. It's important to consider individual preferences and experiences. Every person is different, and what works for one couple may not work for another. Some uncircumcised men find that they can adapt their techniques during intercourse to enhance pleasure for both themselves and their partners. Experimentation with different positions or techniques can lead to discovering what feels best for both individuals involved. For those who do experience issues related to an uncircumcised penis, there are various solutions available. Medical professionals can offer advice on managing conditions like phimosis or infections. In some cases, circumcision may be recommended as a treatment option, while others may find relief through non-surgical measures, such as gentle stretching exercises or topical treatments. Education and awareness are critical in promoting a positive understanding of uncircumcised penises. Open discussions about sexual health, hygiene, and anatomy can empower individuals to take control of their sexual well-being. Public health campaigns aimed at educating men about proper care for an uncircumcised penis can help reduce stigma and encourage healthy practices. Cultural attitudes towards circumcision and uncircumcision vary widely across different societies. In some cultures, circumcision is viewed as a rite of passage or a religious obligation, while in others, it may be seen as unnecessary. Respecting diverse perspectives is crucial in fostering a healthy and inclusive dialogue around this topic. In addition to cultural factors, personal beliefs and values play a significant role in shaping individuals' choices regarding circumcision. Some men may choose to remain uncircumcised for personal, religious, or cultural reasons, while others may opt for circumcision for perceived health benefits or aesthetic preferences. Regardless of the choice, it is essential to approach the topic without judgment and with an understanding that each person's experience is unique. In conclusion, While there can be challenges associated with having an uncircumcised penis during intercourse, many individuals find ways to navigate these issues successfully. Communication, education, and self-acceptance are key components in fostering positive sexual experiences for both partners. By understanding the anatomy and potential concerns related to uncircumcised penises, individuals can empower themselves and their partners to engage in fulfilling sexual relationships. Ultimately, the focus should be on mutual respect, understanding, and an open dialogue that prioritizes the well-being of both individuals involved.